Revolution. Hope you're good. Welcome. How was your day? Happy weekend. Anyway, I'm in Lagos, Nigeria. I'm in North, and this is what I do. So about 3 days ago, we were able to talk about erectile dysfunction. And like we said, we have various types of sexual dysfunction in men. And so tonight, we want to talk about what we call premature ejaculation. Premature ejaculation. And talking about premature ejaculation, let's share to our friends on Facebook and all that. So, like we were saying, that we have various types of sexual dysfunction in men. And when we're talking about sexual dysfunction, we have various types, we have various causes, we have various complications, various symptoms, and we were able to trash sexual dysfunction, which is called erectile dysfunction in male about 3 or 4 days ago. And it has been up and down, job, and all that. So today, let's talk about premature ejaculation. Premature ejaculation. Talking about premature ejaculation is a state of sexual activity that a man is not able to sustain an erection for a longer period of time. You understand? Some books said from between 0 second to 60 seconds, but some say from 0 second to 90 seconds. That's 1.5, 1 minute 30 seconds. And some school of thought say it's between 1 minute to 3 minutes. Now, if you are not able to sustain your erection as long as the maximum of 3 minutes, or you are not able to do up to 3 minutes, you just do, and that's, they said, it is premature ejaculation. And talking about premature ejaculation, we have two main types of premature ejaculation. Talking about the types, we have one, what we call lifelong premature ejaculation. And talking about lifelong, it simply means that it happens in men, especially younger men, that are just having sex for the very first time. You understand? So because of anxiety, esteem problems and all that, they might have premature ejaculation. That is lifelong type of premature ejaculation. Then the other one, we call it acquired premature ejaculation. Talking about acquired premature ejaculation, it is the type of premature ejaculation that happens to you after you have been having sex. It's not your first time, but you now came down with premature ejaculation. That is acquired. While the first one that is just happening in someone that is just having sex for the first time, a male having sex for the first time, is what we call lifelong premature ejaculation. Why acquired? It has been happening, and you're welcome. Thank you. It has been happening, and because premature ejaculation is you have been having sex and it's just happening, and you have not experienced it, that is acquired premature ejaculation. And talking about the causes, we have various causes when it comes to premature ejaculation. It might happen in all men at a certain stage in their life. Maybe they're still growing, or you're having your first time, or you're having sex for the first time, or you're having a lot of things. It might happen to anybody at any point in time in life. The first person is early sexual experience. Yeah, you don't know, you have not had much experience about sex. You are coming, you are just new, maybe you are 20, in your 19, in your late teens or early teens, and you want to, practice or experience what sexual experience, you want to feel like what is sexual experience, and you go into that. When you go into that, one of the causes, because there is anxiety built up, you don't have any previous experience, you have not had it. You are thinking, will this lady accept me? You are thinking maybe you have problem with your body image before, and you are thinking maybe, all those things, you might not be able to concentrate. For a man that has been having sex, you have the experience, you are more relaxed, and you are with a partner that is understanding. You don't need much consent, you understand yourself and all that. You'll be relaxed, and it will be easy for you to have sex, and no anxiety, no sexual performance anxiety, and you are able to have sex normally. But because you are a first timer, it is not always funny. So that's one of the causes. That's the number one cause, because from teenage you will begin to, because of adolescent and all the hormones that are pumping in our system as puberty, we want to start experiencing things. We start having different feeling from the one we're feeling when we were, much younger, under 10, under, when you are not too conscious about your body system. And of course, it can be as a result of poor body image, especially if you have been having issues with your body image before. You have self-esteem problem, somebody has been abusing you, you are too big, your penis is too small, this and that. If you have body esteem, or you have a big tummy and you're not comfortable with it, or especially when you're coming from a background, when we have people that usually bullies you, they used to remind you of, oh, your body is not fine, you are not handsome, you're not this. By the time you get down, you want to get down in a woman, you might, if you're not properly focused, if you're not properly, you have not properly managed, you understand, the self-bullying, the bullying, and you have accepted it as a norm, then by the time you want to make out with your woman, of course it's going to play out. That's why sometimes you meet some people, their own, they cannot make love with lights on. Their own is they want to make love when there is no light. Everything, they can't even go naked. Most of them had esteem, body image issue. They have esteem issues, and they don't even believe their bodies are beautiful. They don't even believe they are good for nobody. I've been through that when I had a broken relationship for a very long time. You understand? So it's one of the things. And of course, if you are going through depression, depression can happen maybe as a result of the relationship you are in. It can happen because of your job. Depression is a form of mental illness, you understand? And it is not above anybody. You can't say it cannot happen to me. It can happen to anybody. Maybe you have heard about somebody that have committed suicide. You have heard about somebody that maybe they go and jump inside the river, hang themselves, drink poison or something. Most of them have been going. Good evening, welcome, Taiwo Modino. Santa, you're welcome. My name is Pollution, Nurse Pollution. Good evening, welcome. So most of them that you see jump inside the lagoon, drink poison to kill themselves, hang themselves or something, most of them have been going through depression. So if people are around them, people would have been able to, pick, because there are some things, they say all manners of things when they are going through depression. We'll be treating that maybe by next week. They give you all manners of hints, as if they are tired of life, they want to die. You see them, some are moody, they stay in their room, they don't want to bath, they don't want to eat, no communication, even their phone. They were once lively, you see that they are no longer lively. That's why, especially if you're a woman or a man and you have kids that are teenagers and or early adults, like from 21 and all that, and they used to be so lively around you, and they come home and you see them brooding, you see them, glooming and staying aloof, staying on their own. It's not enough to just leave them and say, it's adolescent. No, it's enough for us to pull them to our side, talk to them, and let them know, ask questions, probe. Or especially if you have children that are in boarding houses, they're not living within your, in the confines of your house. Maybe because of job or circumstances of life, they are living somewhere else in the hostel or something. If they come in, there's a child that is, curious, that is lively, and they are just there. You have to, oh, thank you. Thank you. So you have to, press them, ask questions. Don't just leave them. Because if we don't get to nip it in the bud, it can lead to suicide tendencies. they start having as audio and visual hallucination. They say they are hearing some voices, they are seeing some people that want to kill them, and before you know, they will just tell you that one day somebody asked me to go and jump inside water. But in Africa, most of us will believe it's spiritual problem, whereas most of the time it is not spiritual problems. So they need help. So people that are going through something like that, if their spouse are not the type that is intentional, at times you have intentional spouses, people, spouses that do things for you out of their own volition. They are ready. If you are doing interracial marriage or intercultural marriage, they want to learn your culture. They want to be with you. Oh, sorry there. Sorry to hear that. Sorry for your loss. May God comfort you. So that is it. You don't have to leave people that have depression. Yes, I'm from Nigeria. I'm in Lagos, Nigeria, Southwest. So you don't have to leave people with depression and say, it's spiritual. No, nothing is spiritual about depression. They have gone from positive, gradually going to negative before they decide to kill themselves. That's why majority of people going through depression, if they are not being helped on time, or if they are speaking, you are not listening, or you are listening, you are not picking. There's difference between listening and picking the points. You understand? If you're able to pick, there's feedback, you'll be able to get it. So somebody going through depression might, of course, come down with premature ejaculation. Somebody that is not ready to bath, that is not ready to communicate with nobody, that is not ready to eat. Most of them, they prefer to stay in the room, dirty from head to toe. Is it that kind of a person that you call that, Oni, I want to make love or something? So we should, whatever you are living with someone, they are going through things, they might not want to open up, but there are ways we can do it. Like I always say, seeking for help in whatever situation you're going through is not, oh, I don't know. I don't know. I'm just doing my thing. Yeah. Okay, there. Hi, you're welcome. Thank you. So that is it. Depression can cause premature ejaculation. Then at times when you are worrying about sexual performance, you have anxiety because you want to perform sex. You understand? And you're like, will I be able to? Will I be able to satisfy? Will I be able to? You are anxious as if you're going for an interview, a job interview or something, or you have submitted a proposal and you are going to defend your something. You are anxious. If you are anxious before love making, at times especially when you are meeting a new partner and you want to have sex for the first time, or you want to meet them for the first time, at times if you are not the type that is like the extrovert, you understand? If you are introverted, it's your nature. There's nothing you can do about it. So, all right. Why are you here? Taiwo Modina, if you are 10, you are not supposed to be here. So that is it. You have to make sure that you are not anxious. You are not anxious. You have to relax your mind so that you will not come down with premature ejaculation. And when you are meeting a girl for the first time and you are having anxiety, and you allow sexual performance anxiety to overtake you, and you come down with premature ejaculation, she might even be disappointed. She might even be disappointed. Then apart from that, if you have erectile dysfunction, we did erectile dysfunction about 3 or 4 days ago, where we said that erectile dysfunction is the kind of, this time around there is no erection that is able to sustain you for a love making, whereas the when it comes to premature ejaculation, there is an erection, but it's not strong enough to complete what it's supposed to do. That's the difference. So if you're having erectile dysfunction, you are already as good as having premature ejaculation. Then of course, yeah, if you're having relationship problems, maybe you have been going through this, you have been through this one once. Good night, thank you. If you have been going through it once, and your partner is not supportive, or you are not communicating what the problem is. You don't understand. If you have issues with your health, especially your sexual health, it is better to open up to your partner. Bye bye, Taiwo. Thank you. It's better to open up to your partner. And so if you open up, your partner will be able to assist you, whether you're a woman or a man. So if you're having problem, maybe you have had it once. Ah, sweetheart, let's talk about this. This is what I experienced. What is happening? So you'll be able to reach a conclusion and be able to seek for help as soon as possible. So it's not the time to keep mute and say, no, I don't want to. I don't want to. You understand? You don't have to be silent about your health issues. And apart from that, if you now have relationship problems, maybe there are crises in your marriage. That is why when you have crisis in your marriage, there are bound to be conflict of interest. It's not your mother that give birth to your wife or your husband. So if there are relationship problems, it is better, and there are conflict of interest. Even internationally, they have various in Africa. We have various in all over the world that are there as conflict resolution people, resource persons. That is what they do to resolve crises. It can be communal crisis. It can be international crisis. We have various people that have been, that's their own job that they are known for. You understand? So you should expect crisis in your own relationship too. Your relationship might not be that every time clapping for each other. There are bound to be crisis. So when there is crisis, what do? You have to resolve it. So if there is resolution of crisis and there is no tension between you and your spouse, it's going to be very, very easy for you to be able to have sex, have it abundantly, and with the help of your partner. But when there are relationship crises, there are tensions in the relationship, you might come down with premature ejaculation repeated times, and you still not be able to get a solution. For example, you have issues with your woman, and it's not resolved, and you are like petting her to have sex, and she's just there like that. What happens? You will still come down. It boils down to the same problems. And it can be inherited traits, you understand? Most of the times we have heredity, something we call heredity. Something that has happened to my mother can happen to me, to my father, to my uncles and aunties, So when we're talking about premature ejaculation, it can be an inherited trait. Maybe it's in your family lineage. And of course, it can be due to something we call idiopathic. All these causes that we're talking about, they have done all manners of tests, this and that, but still, they have not gotten anything that they can say this is the cause of premature ejaculation. And of course, it can be related to stress. Stress, especially in men, they go through a lot from one job to another, from crises and all that. So if you are going through stress and you are burnt out already, you can come down with premature ejaculation. It can be as a result of irregular hormones. There are some hormones in our body, especially men. They have like the testosterone, they have the androgens and all that. And we all have dopamines, which is the hormone of love. We have cortisols and all that. If you have all those hormones inadequate in your body system, it's not up to what it's supposed to have, and the hormones of sex, you might come down with premature ejaculation. But if there are hormones of if they are adequate in your system, you might not be able to feel that. But if they are not adequate, you might come down with what we call premature ejaculation. And of course, if there are brain chemicals, we call them the neurotransmitters. Now, when a man is ready, most of the time, men are moved by sight, what they see. You understand? And they are moved by what they see, while women are moved by petting. So if you are a man and you have seen something, then the message from your eye like that goes through the brain, through the spinal cord, and there are nerve transmissions and all that, blood vessels, flow straight into your penile area, and you are ready for erection, ready for sex. But if the hormones that are supposed, the chemicals, the neurotransmitters that are supposed to do that for you are not adequate in your brain, the neurotransmitter, you might come down always. That's why most times it might be difficult for you to treat, or for us to treat some people when they are going through premature ejaculation. And of course, it can be as a result of swollenness or infection at either of the testes or the prostate. The testes is within the male reproductive system, and of course, the prostate gland is the gland that helps men to produce fluids that will make their sperm move. Additionally, when the sperm is produced, it's thick, and if it's thick and the prostate is not able to produce its own fluid, it means the sperm might not be able to go to get to where there is egg for pregnancy to take place. So if there is an infection of the prostate or infection of the testes or swollenness of the both of them, you might come down with premature ejaculation. And of course, if it is stress, there might be stress. If you are stressed up or you are anxious, maybe because you are meeting somebody for the first time, it can be an issue in your relationship. So those are some of the causes of premature ejaculation. Let's go straight to the point about symptoms. What are the symptoms? How do you know you are having erectile dysfunction? Number one is ejaculation earlier than between 0 second to 60 seconds. Some school of thought say it is 0 to 60 seconds. Some say if it's lesser than 1.5 minutes, 1 minute 30 seconds. Some say if it is lesser than 3 minutes. You understand? You understand? Because most of the time when you want to have sex, the woman might not be ready even in that 2 or 3 minutes because of our own nature. So you ejaculating early is the first sign when it comes to premature ejaculation. Then apart from that, another symptom is distress and frustration. Where all men, if you are in love, or all women too, you are in love, we all have the feelings or the determination, let me put it, the determination to satisfy our partners. You understand? And when we have the determination to satisfy our partners, it boils down to physical satisfaction, financial satisfaction, moral satisfaction, and of course, sexual satisfaction. And to some, it's even the most important. You understand? But when you are not able to do that, you come down with distress and frustration. Because even when the partner says, oh, you are distressed, you don't want to do, when your partner is calling you. And of course, another symptom is inability to delay your ejaculation. You might not be able to delay ejaculation. You are just there, and before the woman is even ready, oh my God, oh, before the woman is ready, you are done within seconds. NEPA has shown Nigeria, oh, NEPA has shown. Before the woman is ready, all right. So sorry for NEPA. So before ready, you are done already, because before the woman gets wet, get ready, you're still petting, you're still, so the woman most of the time will not be able to reach orgasm. So distress and frustration is one of the symptoms of premature ejaculation. And of course, it can be you can have performance anxiety. because we've been going through, you have issues, you've been having issues with you've been having issues with what we call premature ejaculation. This time around, there is an anxiety. You are not comfortable. You are anxious. Maybe you have had it yesterday, and your partner says, "Okay, let's try again today." What do? You are anxious. You are anxious. You don't want to do. So that's performance anxiety, and of course, it can lead you to negative self-image, especially if your partner, like I handled the case about 2 years ago, I think 2023, and the wife, during counseling, was just saying, "You are just 2 minutes no do. You are just 2 minutes no do." She started sleeping outside of that marriage. She started cheating, and the man has been going through that premature ejaculation for 3 solid years. So because the man has been going through that for 3 years, she is now like, you can't do anything. So she started sleeping around, and the husband caught her cheating and all that. They came for counseling, and she was just, talking the man down. And you are 2 minutes, man. I cannot come and give. I cannot come and enter depression when I'm not having good sex. All those things. It really is not good. It can lead a man to negative self-image. You might just not love him or love himself again and his body. And of course, when it's like that, it can lead to loss of sexual intimacy. Because what's the essence? I can't do. If I do, it is wahala. What's the essence? So people will your spouse will you are losing your spouse gradually if it is like that. That is one thing. Then how can we overcome premature ejaculation? How can we overcome that? Number one way to overcome is what we call stop and start method. And what is stop and start method? When you are ready as a man to make love, you make sure that you penetrate your woman. After penetration, what do you want to do? You stop temporarily, just within. You are ready. There is little erection. Insert and withdraw. That's stop and start method. Then you start all over again. It's a form of exercise. So, assist the muscle of the penis to, gather strength or something like that. And of course, there's something we call squeeze technique. When you are already there, you squeeze the midpoint of your penis to prevent you from ejaculating early. That's the second method. This is a technique. We call it squeeze technique. You squeeze by the base of your penis to make sure that you don't ejaculate prematurely. Then, of course, there's something we call Kegel exercises. Talking about Kegel exercises is just exercises done to, how do I put it, to strengthen the muscles of the pelvic. When we're talking about pelvic, all these places that we sit upon, or this our bum, then the bones that is with inside our bum, all our reproductive areas, both male and female, we call it the pelvic area. So when you now want to do either the Kegel exercises, it's like you are squeezing. Something you do, especially when you want to poo, and the poo is already there, but the atmosphere you are, the environment is not where you can poo, and you now decide to squeeze your anus. You are trying to squeeze it because you don't want the poo to come. We call it Vasava maneuver. So when you're talking about Kegel exercises, it's like the relaxation and contraction of the muscles of your pelvic, all those areas that you are sitting, you are just moving it, you are releasing it. It's a form of Kegel exercises. It helps even for women, it helps in men too. Then you can masturbate. It is possible for you to do either self-masturbation or your partner masturbate you to release before you now have sex. In that way, you are more relaxed. And because you were able to communicate, you've been able to communicate and buy your partner to your side. Not you are this time around, you're not doing I'm the man, I'm the man. When it comes to sexual problem, you have to calm down and be able to discuss with your partner. If not, center will not be able to hold water again. Is what I've seen. I've like in the last 5, 6 years, I've been on counseling with people like this, like more than I can't say it's 50. You understand? So you don't most men will be saying I'm the man. The woman will start sleeping around. Though I'm not justifying cheating. But when a woman is in the house 3, 4, 5 years and you are going through premature ejaculation and you are not saying anything, you some men, even with my experience from counseling, I found out that most men don't even know that women enjoy sex. They just believe that immediately I insert and I pour, you have enjoyed me. They don't even know until the woman starts, the voice of a crying woman starts saying, oh, this, that. So you can masturbate before or during intercourse before you release. Instead, like the first one, we stop and start. This time around, the second one is squeeze and you're still continuing. But this time around, it's either you masturbate before or between, during, before the premature ejaculation, you masturbate. So that when you masturbate, your muscles get strengthened, you are more relaxed, you are more calm, and you'll be able to perform your function. And of course, if you have underlying conditions, because like some of the causes are like people that have diabetes, people that have hypertension, you understand, or various heart conditions. Because when your heart is having issues, there is impairment in blood flow, and before your penis can work, uh, can function very well, when a man sees a woman that he likes, you see with your eye, the message goes to the brain takes it to the spinal cord. There are nerve endings. They transmit that information that this man is ready for sex. Then the information gets to the brain releases certain things, hormone, chemicals, neurotransmitters, dopamine, cortisols, and all that. And of course, they move straight to the penis, and the penis become erected, ready for love making. But when these hormones are not adequate, or when you now have heart problems, blood might not be able to live where it's supposed to live in the heart and come and function in the penis where you need it as at that material time. So if you have any heart issues, or you're not sure you have any heart issues and you are having persistent premature ejaculation, it is time to take a visit to the doctor. Seeking for help when it comes to health and certain things is not a sign of weakness. Except you don't want to say, I want to use faith. It's not something you can use faith. Before you know, even pastors, I've had to counsel pastors that their wives are going through hell, and some is the pastors that are going through hell when it comes to sex, and you see them in church on Sunday morning, on Sunday, everything is, and they live happily ever after. Some people are going through hell when it comes to relationship. So if you are not diabetic, you are non-hypertensive, you have heart issues, you have any underlying health condition, it is better to seek help early so that they'll be able to give you some drugs. And if you're on hypertensive, there are some hypertensive drugs that can give someone premature ejaculation. There are some that can give you erectile dysfunction. And what do you want to do? It is better to talk to your doctor. Oh, since you have given me this drug, I've not been able to sleep with my woman. This is what I've been going through. And there will be something we call review. Not that they have given you drugs since January, hypertensive drug, because you have been checking your BP and everything is going fine or something. Some of us don't even check in this part of the world. And you check. Oh, I say I'm okay. By June, this is August, you have not gone for a second visit in January. Wow. It's not right. You have to continue visiting. Like people that are living with HIV/AIDS, they don't HIV, they don't allow them more than 1 month medications, because if they give you drug for the whole of January, that's 30 days or 31 days, they expect you to come back. They will just give you 30 or 31 days. They expect you to come back at the end of that 1 month to come for viral load checking. Is this drug we are giving you? Is your the viral load in your system? Is it going up? Is it average? Is it below? Is it okay now? So that next month we'll be able to know, are we increasing the dosage? Are we going to, lower the dosage or maintain the status quo of what you are going home with? So that's what they do for people living with HIV, for people living with diabetes, people living with um, various heart conditions or hypertension or cardiovascular diseases. Most of us don't know how to go for follow-up, except somebody now falls down in the house and it now become now become a hypertensive emergency, and they take them to the hospital. So if you're on any drug, it is better, and you are going through premature ejaculation, it is better to seek help, because you need to go back to your doctor and let them know this is what you're going through with your condition, so that they'll be able to know what to do. Then your lifestyle matters. Sleep. If you are not the type that sleeps very well, it's recommended that between 7 to 10 hours. But some say, is it achievable? Some say, okay, let's do 7 to 8 hours. Some is still not achievable. Some do 6 to 8 hours. But I want to tell you, there's something we call sleep depth. Talking about sleep depth, if I'm supposed to have 6 hours of sleep on Monday, for example, let's say from Sunday, on Tuesday, 8 hours, 8 hours, that's 24 hours. On Wednesday, another 8 hours. Let's say in a week, 8 hours times 5, that's 40, Abi. Yeah. Then in during the day, during the week, let's say, for example, I'm supposed to have 70 hours of sleep. I don't know mathematics, I'm a nurse. Let's say I'm supposed to have 70 hours of sleep, and on Sunday I'm able to have 4 hours. I'm owing 4 hours of sleep debt already. That's sleep debt. On Tuesday, I'm supposed to sleep 8 hours according to the scientist, and I'm just able to get 3 hours or 5 hours. I have 3 hours debt. By the time I'm going through a week, I've had 5 hours, 6 hours, all those ones that I'm not able to meet up with my sleep. Let's say out of the 70 hours, I've been able to miss 25 hours of sleep. You understand? Remaining 45 hours that I was able to meet up. Next month, the same thing. Next week, the same thing. I keep going. All these things can lead to dementia in the nearest future. That's memory loss, Alzheimer's, a lot of degenerative changes of the brain. You understand? Sleep deprivation has a lot of effect. Don't say, I've been doing it, I'm used to it. In fact, I sleep 2 hours every night. The body is storing the sleep there. By the time it's going to take a toll, at times it might not be funny at all. You understand? So your lifestyle is very important. Your sleep has to be balanced before you can say, okay, you want to have good sex life. And of course, you have to reduce your stress. You have to reduce your stress. You might be at home, you might not really sleep deeply, but you're at home, you're doing things that you like, you're not going anywhere. It's still a form of a way of distressing yourself. You are reducing the stress. Then, of course, if you are a non-alcoholic and you take excessive alcohol, it is time to reduce that. There are some things in your alcohol that can interfere with your sexual health. And of course, if you are the type that does like this, you smoke, ordinary cigarette has over 200 ingredients, from tar, from nicotine, and all that they add. That's why government insisted that they should put that all smokers are liable to die young. Still, people are still smoking anyway. So when it happens like that, we should know that as with the premature ejaculation you're going through, you have to quit smoking. You can reduce alcohol, which is still understandable, but for smoke is a no, no, no. You have to reduce. You have to quit smoking. You have to quit smoking. Then your salt, your sugar, you have to eat a well-balanced diet. And talking about well-balanced diet, that's a diet that consists of all the 7 classes of food, like the water, the mineral salt, the vitamins, the fat and oil, the protein, the carbohydrates, and what is it now? I think it's 7 now anyway. So you have to eat it in right proportion. Your sexual health, if you eat vitamins or you eat fruit or you eat fruit or vegetables, they stay maximum of 3 hours. Their vitamins stay in your body maximum of 3 days, 72 hours. That's why you eat, if you like, eat a whole bunch of, for example, maybe pineapple or um, uh, bananas or something. When you want to poo the following morning, you will see them in the toilet. So our body does not have a way to store vitamins and minerals for longer period. But your carbohydrates, your protein, your fat and oil can be in your system for the next 3 months. For example, if I eat like 2,000 calories of carbohydrates today, and tomorrow I'm not eating, in the morning maybe I'm fasting, and I'm not eating till tomorrow evening, or maybe let's say I'm doing 3 days fasting. The fat and oil that I've eaten, the protein that I've eaten, the carbohydrate that I've eaten, my body, and the water, those 4 classes, my body will break them down. As soon as you eat, your mouth takes it, digestion starts from there through the esophagus, go down into your stomach, which is by the left side of your tummy inside. Then the stomach will digest up to a certain extent, pushes it to your small intestine. Small intestine will now do it like the poo poo poo, and make sure that it's fine, like a pap. Then from there, the liver takes it. Liver is like mama in the house. Then the liver begins distribution. Give some to pancreas, give this to kidney, keep this, keep some with this, keep like that, keep. Then before the kidney now takes and say, okay, this is dirt, let it go to poo. This is dirty, let it go to wee wee. This is the skin will take its own. This is dirt. Will come out as sweat. Those are different ways that we have waste that is being eliminated from our system. So if you now eat today and tomorrow you not eat, next tomorrow you're still fasting, the other day you're still fasting, the body will just come and break those things down, the storage before, and use it for your body needs today. Next tomorrow you are still not eating, it will still further break down some. When you are not eating for like a week or 2 weeks, maybe somebody is sick or something, then it begins to break down your muscles. All these places, we call them fat depot. These places, these places, begin to break it down. That's why somebody will see you and say, are you sick? Are you pregnant? Because there will be massive muscle loss most of the times. So when it happens like that, there's nothing that somebody wants to do than to just, you know, believe that it is well. You understand? Then apart from that, you can if your own is as a result of relationship problem, you should be able to sort your problems. That is conflict resolution. It's very, very important. And of course, you should be able to see your doctor if you have anything you don't understand about your body. You should not lie to your doctor. Talk to your healthcare professional. They will be able to help you. And of course, what are now the complications of premature ejaculation? The number one complication is relationship problem. You understand? Because your partner will be, what will I do? There's relationship problem. Number two is stress and frustration. And of course, finally, the number three is what we call infertility. Infertility, inability to impregnate your woman. So whatever you are going through, like I always say, seeking help is not a form of weakness, is a sign of weakness. So let's just run through it before we go. We've been able to talk about premature ejaculation, the types, which we call lifelong. That is the one that is happening as a result that you are just starting. The second one is acquired, that is happening because you have been having sex, but it's just, you acquired it. Then, of course, we don't need to talk about the causes like early sexual experience, poor body image, depression, worrying about sex and all that, relationship problem, erectile dysfunction, anxiety, irregular hormones, and all that. So we'll be able to, of course, talk about the symptoms and, of course, the ways to manage it, and, of course, various complications. I remain your friend, No Solution. See you in the next video. Bye bye for now.